This portion of CardioSource Video News is brought to you by Medtronic.
We all recognize that deep vein thrombosis is a major cause of morbidity and mortality. Now, a new study called the TORPEDO Trial looked at the efficacy of percutaneous endovenous intervention compared to anticoagulation to reduce the complications of DVT. Dr. Peter Block joins us with one of the principal investigators.
Okay, well, I'm here with Mohsen Sharifi from the cardiovascular consultants in Arizona at Mesa, Arizona, the Arizona Cardiovascular Consultants, I should say. Isn't that right? So, in any case, the TORPEDO trial, and we're outside of coronaries now. We're into deep venous thrombosis. So, tell me, Mohsen, about this trial. What is it? What is it about? What did you learn? What kind of techniques did you use?
Thank you, Dr. Block. TORPEDO is the acronym for thrombus obliteration by rapid percutaneous endovenous intervention in deep venous occlusion. As you know, for the last several decades, no major shift has occurred in the approach to treating deep venous thrombosis. Different anticoagulants have been introduced, but in reality, no interventional approach in a prospective fashion has been designed and carried out. The TORPEDO trial is the first randomized controlled trial to look at percutaneous endovenous intervention in the treatment of deep venous thrombosis.
So you're getting rid of thrombus in the DVT?
Absolutely.
And how do you do it?
Well, the trial randomized people to those getting anticoagulation alone, plus those who got anticoagulation, plus the interventional approach. The patients were turned into the prone position. Access was gained through ultrasound guidance and using a micropuncture needle through the popliteal vein. Venography was performed, and based on the findings of venography, the appropriate procedure was carried out. This could have been any form of thrombectomy, balloon venoplasty, catheter extraction through thrombus extraction through the catheter, or administration of thrombolytic therapy.
So essentially, you're either taking out the thrombus or you're leaving it behind and letting it be anticoagulated. So what'd you find?
Well, the results were very interesting. We know that two of the complications of DVT are post-thrombotic syndrome, which plagues people several months to years after, and the other one is recurrence of venous thromboembolic disease, which consists of recurrent DVT and recurrent pulmonary embolism. The results indicated that the interventional group that received intervention in addition to anticoagulation, in those people, recurrent VTE was 4.5% versus 16% in the control group. Similarly, the development of post-thrombotic syndrome was 6.8% in the interventional group versus 29.6% in the control group.
Okay, so let's wrap up. Well, how does this information help you with your patient or with my patient that has a DVT?
I think DVT should not be ignored and a more aggressive form of approach should be designed in treating these patients. I think the future is open for interventional cardiologists to get more involved in treating venous disease. And as I can predict, in the next few years, there would be more and more cardiologists getting involved in the treatment of DVT.
Well, thanks, Mohsen. Another area that interventional cardiologists should look forward into, I guess.
Absolutely.
Thank you very much.
It was a pleasure. Thank you.
Medtronic proudly introduces Integrity BMS, now available in the U.S. Visit MedtronicStents.com for more information.